guys, and welcome back to another episode of Women Unleashed. Today I've got the lovely Dr. Anna with me, who is a medical doctor and a hypnotherapist. I'm really excited to have her on today's episode because I want to talk to her about the gap between the medical side of things and obviously hypno, which is more holistic. So thank you so much, Dr. Anna, for coming on.
Thank you, Dominika, for having me here. I'm very happy to be here.
I'm really grateful. I'm grateful because, I've had people in the past who have done NLP, hypnotherapy, but we've never actually dove into the hypnotherapy side of things. So tell me a little bit more about you first, just so the listeners get to know.
So I'm Dr. Anna Kochoska.
Yeah.
I am medical doctor, practicing already 13 years in the medical field. And also certified hypnotherapist by the RTT school from Marisa Peer, if you know the hypnotherapist. And I'm practicing already 3 years.
Okay.
Yes. And I love the hypnotherapy. I love the holistic aspect of it. Yeah.
For sure. Well, there's a big gap between the medical profession and the holistic side. Yes. So it's nice to see people merging the two together. Myself being a nurse, I merge the two together as well. What kind of made you step away from being in the medical side alone and stepping into the holistic side?
Well, I still haven't stepped away completely.
No, but
but I want to merge them, right? What got me into all of these things is basically, let's say, when I was practicing medicine in a clinic, I saw that some of the cases I can even solve them with good advice, good listening, good sending of good energy and positive and hope. So for some people that is very important. And that is like some kind of the holistic way, other way of healing people. And I was always curious about the complementary alternative medicine, this holistic, so all of this sound healing, breathwork, acupuncture, and hypnotherapy. And for hypnotherapy, actually, I was curious because, everyone is
skeptical,
scared. They don't know what is hypnosis. They think it's very scary.
There's this perception of hypnosis being like you see it on movies where all of a sudden you're hypnotized and you become this robot, this other person, and then you snap out of it. Like, that's not hypnosis.
That is hypnosis, but that is stage hypnosis.
Yes, exactly.
Yeah, that is actually just to show how much people are suggestible. But that is not my intention.
Yes.
My intention is to use that method for a therapy, for a treatment, healing, transforming, upgrading yourself.
Okay.
So it's a different way. And it is not just like that few seconds, it's 2 hours.
Yes.
The process, the therapy.
Yeah, exactly. And when you see it on movies, it's literally, you're hypnotized. Yes. No, it's not. I've had hypnotherapy during therapy sessions before.
Okay.
So, I think 2 or 3 times maybe, and a couple of the times it worked really well, and one time I just really struggled.
Okay.
I think it just depends how you're feeling maybe as well.
Well, yes. However, this hypnotherapy that I'm practicing is rapid transformational therapy.
So there's different types.
So there are different types. So this type is you're coming for one session, for one problem or few related. It's not for your whole life. We're not regressing for your whole life. So it is for one problem. And the whole session, 2 hours, is for that problem.
Okay.
So basically, when you're coming to me, you're telling me, I have this problem, this issue, this belief, and I need to remove it, to replace it. So you're coming with that intention, okay? And basically, first of all, you are coming because you trust me, you trust my capabilities, you trust that I can hold space for you, I can help you heal, of course, and help you transform. And when you come and you are relaxed, basically, because you don't need to force yourself in hypnotherapy. You just need to be relaxed, open for all the process. And then you're just sharing to me what you're seeing, what you're hearing, what are you sensing. So
Is one session enough to get rid of a problem?
Yes.
Really?
For the majority of the problem. So you can change, let's say, everything. Every belief that you have about yourself, every habit can be changed. Because it's still connected to your subconscious mind, and we are going deeply to these past scenes that it has all to do with how, why, and when you started having this problem. So we are removing it on spot. We are replacing it.
That's amazing.
It's very, very good.
That's very good. I mean, I've got a list of problems I can come to you with. Get rid of this, get rid of that.
Yeah,
wake up a new person.
Yeah.
What sort of cases have you had?
Well, I have had different kind of cases, let's say medical, let's say psychological, and non-medical, non-psychological. So let me tell you what in Dubai.
Yeah, let's do it. That'll be interesting.
In Dubai, it's always about this achieving their goals, success, abundance, money, have more money, stay focused, to stop procrastinate, to have more confidence and self-love. So mainly, this is the main thing. And the second thing is to stop smoking, to stop vaping, stop shisha.
Okay, does that work for people?
Yes, absolutely.
Really?
I have 100% success rate here in Dubai.
I mean, I'm coming. I'm coming.
Here in Dubai.
I need to work on self-love, and for me, it's like self-belief as well, self-love, self-belief, self-doubt, that sort of thing. Would that fit into like one category?
Yeah, that will fit. Because when you love yourself, you're not doubting yourself. You're stop sabotaging yourself. You're not blocking yourself. You're living the authentic life, true to your desires and wishes. So when you love yourself, really, you're doing everything to make your life better, to be happy, fulfilled, and just saying yes.
Love that. What about medical cases?
Medical cases, let's say from mild to moderate anxiety, mild to moderate depression, PTSD, OCD, ADHD.
All right, okay.
Yeah, still mild to moderate, yes. For the major ones, they need also medication and other modalities of therapy. And also from medical, irritable bowel syndrome, if you know.
IBS,
Yeah, IBS, hypnotherapy is very good for that.
Really?
Yeah.
I mean, I don't really believe in IBS. So here's a new... I don't believe in IBS. No, it's not that I don't believe in it.
Okay.
It's a very umbrella term.
Okay,
to me,
of course.
IBS, like you'll go to a GP in the UK and they will tell someone you've got IBS. Okay, well, what have I got? Have I got dysbiosis? Have I got, intestinal permeability? Like, what is it actually that I've got? Like, it's very broad.
You are having dysregulation of the peristaltic movement of the bowel.
Yeah.
Okay, so it's not moving as it should be.
Yeah.
It's either it is very slow, so you have constipation and basically bloating because the food and the poop is still there.
Yeah.
Either you have diarrhea because of the faster motion. And again, you have cramps, you have bloating.
But there's a reason. Right, but there's a reason why we have this.
Yeah, but the reason is from the brain.
Yeah. Gut and brain connection for sure.
Yes, brain connection. So usually it's because of the stress. It's some kind of like a coping mechanism. Yeah. So whenever you are like stressed or you're fearful or anxious or you just want to protect yourself and you send signals to the gut, okay, you overact and so it's not functioning properly.
Yeah. It's like when you get butterflies. When you get butterflies, when you're excited about something, it comes from your head and into your gut. It's the connection.
True, it's the connection. And this connection now... it's not regulated, but let's say from the butterflies, the connection is first the gut and then the brain. But here is first the brain. Yeah. We have subconsciously something that is stress or whatever it is, and it's connected to the bowels. you know?
Yeah, for sure. And exactly, because you work with hypnosis and you work with that side, you understand that. But a lot of practitioners don't, I don't know if they just know this and they don't want to help or they don't care, but the amounts of clients I have.
They don't see it like a medical problem. Okay, it is IBS. After you exclude everything, after you do all the tests and nothing is there.
Yeah.
So okay, you have IBS. There are some medication that can help, and they are also advising go see psychologist. But also hypnotherapy is already in the guidelines. If you search, you will see the hypnotherapy is recommended.
You never get that in the UK. No. I have clients come to me and they're like, I've been diagnosed with IBS. I says, what has the doctor done? Nothing. I'm like, okay. You see, it's very different
it depends on the doctor. Let's
that's
say
what I'm saying.
I am also suggesting acupuncture. I'm suggesting sound healing. Sound healing is very good for healing of the body because you're sending healing frequencies to all of your cells. It's very important.
I think there needs to be more people like you who link the holistic side with the medical side. You put 2 and 2 together, so many people will get better sooner.
Yeah, absolutely. Better, the disease will not progress. It will not go into cancer or chronic disease. And that's why I want and I love working on this holistic aspect, because I want to prevent diseases, prevent cancers. And we are going towards it because we want to live healthy life. We don't want to be 60, 70 or have disease. Why should we have disease? Absolutely.
I've got an autoimmune disease.
Which one?
Hashimoto's.
Hashimoto. That's also...
We can do.
Of course, I'm doing for that. Because I'm working on the stress level. Because when you have less stress in your body, you have less auto-antibodies, right? So it's not attacking your thyroid. Your thyroid is functioning better. So there is much improvement in this.
So I was trying to find the root cause of my Hashimoto's.
Yeah.
And I've got down to it. We've got mold toxicity, mycotoxin.
Okay.
So have you heard of mycotoxins before?
Microtoxins.
Yeah, mycotoxin.
Okay.
So it's mold.
Okay.
Mold toxicity in my body. I've got ochratoxin.
Okay.
Very very high levels. And mold can be a host of autoimmune disease.
Of course. Its host is provoking. So all of the molds, fungus, parasites, if we have in our body, they are activating the autoantibodies and autoimmune diseases.
It's good though to know that I could do a bit of hypnosis and reduce the stress levels and work on that. I'm a very fast-paced person. I'm always on the go. I can't slow down. I'm so bad at it, and it's not helping.
Yeah, it's not helping. Yeah, it's not helping for anyone if they're always fast-paced. You have to make during the day breaks to be present in the
moment. Yeah,
this is very important. Yeah, and it comes with practice.
Of course. I'm working on it.
Yeah. I mean, I was also like that. So let me tell you, I was not this calm
all the time.
So but with practice, first of all, I had like booked a timer. I put timer for mindfulness and breathing exercises for like 2 minutes. You're just breathing deeply, focusing on the air, what you're seeing, what are you hearing, what you can smell, you know, all of this, getting back to the senses. So first I had timers and I had to do it. And I was doing it like few months until it became like
a habit.
And now I'm doing it like a lot of times during the day. A lot of times. That's why when I came here, I told you, okay, let me breathe. Let me collect myself, you know, because I was just rushing
all around, and you wanted to come into it calm and peaceful. Yeah, of course, I get that. Now, tell me how hypnosis works.
So, hypnosis, with hypnosis, we are putting the patient under this hypnotic state, that is the relaxed state, that is the alpha and theta state brain waves.
So for people who might not know what alpha and theta states are, is that the state that you are in just before you go to sleep?
Yes, absolutely. So alpha is the meditative state. You know, when you're in complete meditation, let's say, or maybe you're watching TV, you're completely relaxed, you don't even, or you drive and you're forgetting. Oh
Why
my
are you
God.
driving? Yeah.
Yes, so that is the alpha, the completely relaxed state when your mind drifts off. And theta state is just before falling asleep. That state between like reality and dream. Yeah. So we are fluctuating through this.
How do we stop falling asleep?
That is my
Your job.
my job.
Okay.
Yes, because first of all, I'm telling you, okay, you lay down in a comfortable chair, right, semi-seated.
Yeah.
And then I'm telling you, okay, look up, then close your eyes, then you're going down the stairs, and other induction technique to make you relaxed completely. And so if I don't react here, like with the tone of my voice or touching your forehead, you will fall asleep.
Yeah,
completely.
I had that.
Yeah.
So I did my therapy through Zoom. So obviously when we did hypno through Zoom, it's a little bit different. So the first time it was really good, like I went through it, but towards the end I fell asleep, and she just had to wait till I woke up.
Yes. Well, I'm also doing through Zoom, but I love it more in person. So I reduce the Zoom as much as I can. But if someone really wants me, I'm like, okay, we will try. We just need very good connection, and I need the camera to see your face.
Yeah, to see
like
if you're falling asleep.
Because I need to see the movements if you are falling asleep. And then if I see falling asleep, I will just do like, like on
That's
the microphone.
What she did. She clicked,
or louder. So these are the techniques. But, you know, in person, as I said, yes, with the tone of your voice, I will touch your forehead to activate the frontal cortex. And also I'm starting the therapy. I'm guiding you to the passing, and then you're telling me what you're seeing, what you're feeling. And I'm telling you, okay, have this conversation. And so it's like 2 hours conversation.
Okay.
Yeah.
Nice.
So you will not fall asleep.
Yeah. It's constantly that.
Yes.
Okay. I feel like I need to do hypnotherapy.
Yeah.
Have you ever had people... I'm guessing most people enjoy it, right?
Yes, of course. I mean, it's a process. Let's say first it's uncomfortable process because we are going to some scenes that are usually not nice, not happy, so with a lot of abuse, physical, verbal, sometimes sexual, and so that is not pleasant, right? The client is crying, and it's good. If he wants to cry, it's good to cry because it's releasing of the emotions. So the first part is the uncomfortable part when we are seeing the root cause. But then the second part of the session is the healing. So after that, you're feeling much better because you have released that, you have changed it, you have removed it, and you feel lighter. So usually they always feel calmer, they always feel lighter, they always feel more positive, more hopeful, more empowered, confident. It depends like what they needed.
Can you come out of it and feel worse before you feel better?
What?
Can you feel worse before you feel better? Like after coming out of hypnosis?
No, after coming out, you cannot feel worse.
No?
Absolutely. No.
I felt really emotional one time.
You can feel emotional during the session, as I said. That's why this session is like 2 hours.
Yeah, mine wasn't that long.
That's why I like this. It's not like, okay, we are seeing the problem and then we are working very little on the solution. We need to work very little. I need to see that you have done the transformation. I need to see it through you, and I will not leave it until, I see much improvement. And then we're like, okay, now you can open your eyes to your better future. Like
I love that.
Yeah.
I love that. Have you got any success stories?
I have many success stories.
Do you want to tell me your favorite?
Well, I'm very happy when I see the people that are becoming more confident, more successful, because I'm following them on Instagram. Oh, so and I'm see the success and everything, and I'm like, oh my God, it's like,
it's due to
I'm
you.
so happy. Yeah, I'm so happy they're progressing because they're living their true potential. You know, you just give them the boost. It was already there. Yeah.
Okay.
And people, when they just message me like, or after stopping smoking, like, oh my God, my life changed and everything. It's very, very nice.
Yeah, because obviously bad habits like, smoking, alcohol, that sort of thing, people struggle to get out of that. So it's good. It's really, really good to know that one session is enough, because I thought you would need a lot more.
Yeah. One session is enough. And why it is working is because, we are doing the session, and after that you are, empowered. And the very next day, I'm giving you audio recording, hypnotic audio recording, that it has all the suggestions that you wanted to accomplish, and something from the session. So you need to listen to it for 21 days straight, so you will not relapse, because things will happen. There will be some stress, there will be something
you'll go out, somebody will offer you a cigarette, sort of
so
thing.
you should not relapse. So that's why I'm giving the audio recording, and you need to listen to it for 21 days, so you will stay with this new habit.
Every morning, every night, does it matter?
Before falling asleep. So either before falling asleep and you fall asleep with it. Yeah. With this one, you have to fall asleep with it, because your subconscious mind should be listening. So either before bed or in the afternoon if you're taking a nap after lunch.
Okay, fine. Yeah. And have you done anything else other than hypnosis? Like sound healing, that sort of thing?
I have done a combination with breath work after hypnosis, and I'm in a collaboration right now with one girl to do sound healing with hypnosis, because I'm doing also this group hypnotherapy. So when I'm doing group hypnotherapy, I'm putting sounds for healing vibrations, healing hertz, but it's better when
it's actually there.
So I'm working on that.
Okay, that's exciting. Yes. How does a group therapy work?
Yeah, well, the group therapy, usually I do it for the three caterpillars, let's say the most important things. So we are removing limiting beliefs for money, abundance, wealth, success, and confidence. The other thing is for the health, for body image, and everything that is health-wise, diseases. And the third thing is for the self-love and confidence. So it's like a whole circle. We are removing all of these things, and then you're again going to your future self. You're connecting to your future self, to the habits and the beliefs of this new person that you want to become.
Yeah, and group sessions work well?
Yeah, they work well. So these are generic, right? So it's like 1 hour. It's only 1 hour. So I'm guiding the hypnotherapy, so there is no speaking. They're just listening. So I cannot go into details. We cannot go into detail process.
For you, yeah.
But it works very, very good. If you want to, let's say, if you want to try hypnotherapy and you're still skeptic, you can just try this and see that it works good. And if you feel that some scene came up and you cannot process, you can just come to me and we can process it in person.
Yeah, that's what I was going to say. It's like a taster session for people.
Yes.
To give it a go if you're unsure or if you're scared.
Yeah.
Give it a go and then kind of go from there. So, do you only do it in Dubai?
For now, yes. Yeah.
And do you have your own studio?
I rent studios in wellness center. Okay. So at the moment in Prana House in Motor City.
Yeah.
Yeah.
Okay,
so
nice.
There, yeah.
How many days per week do you do it? Or just kind of when?
It depends. Yeah, it depends. On individual group hypnotherapy, I'm doing once a month. Mm-hmm. Yeah. And the other one are...
You kind of go as it goes.
Yeah, as it
goes. Is
there
anything that you feel people should know about hypnotherapy that you think they might not know? Like an interesting fact?
Well, that is not scary. I will tell them it's absolutely not scary. It's absolutely, you can go out of it whenever you want. You know, it's not like you will stay. It's not like I'm controlling your mind. Okay, so you're in control all the time. And it can improve your life significantly. Significantly, because all of the other majority of the other treatments are on conscious level, and this is on subconscious level. So it's a very good technique also to understand yourself, because sometimes we are thinking, I'm acting this way because of this happened, and something else will come up that we have forgotten, some other scene. So also there is a lot of surprise moments, like, oh my God.
That's good. That's nice. You dig deep, you know?
You go deep. Yeah, you go deep. Some, they go like as they were babies, some like 2 years, 3 years. And, you know, they are surprised.
Have you had hypnotherapy?
Yeah, of course.
How did you find it, like, from experience?
Well, I found it very profound, and it helped me a lot. So I did hypnotherapy from curiosity, just to see how it looks. And when I saw, oh my God, it has so good effects. And I was like, okay, let me study this, let me practice this. I loved it so much.
How long was the studying part of it?
2 years.
Okay.
So usually it's 1 year, the study part, but I was working in a hospital, so 12-hour shift and everything. So I finished in 2 years.
Part-time. Yeah. That's amazing. And it's really, really nice to see that a medical professional is going into the holistic side and combining the two methods, and not just going, here, take some anxiety medication. Why don't you try some hypnosis?
True. We need to go deeper, more deeper, and especially, you know, for women, it's very important, because we need to empower the woman. You know, a lot of women are strong, but they are not empowered. They're resilient, but they are suppressing everything inside. With this method, we are giving them, again, the power back, and the power to be themselves, you know, to be authentic, to have a voice, you know, to speak up. Yeah, a lot of women, they don't do that.
No. And I used to be the same. And that for me, like, my thyroid problems is my throat chakra, not speaking up, you know, whereas now, verbal diarrhea, I just say whatever now. I don't care. I tell you what I think, whereas before I was very much so, you know, I wouldn't, and a little bit quieter and everything else, whereas now it's just like,
now is good.
It's better.
Because even if you are saying, okay, verbal diarrhea, right? It doesn't mean that you will offend anything, or you will be not good, unpleasant, or you will, you know.
I just say what I think.
Yeah,
you know?
Absolutely.
And you either like it or you don't.
Yeah, absolutely.
I would rather that than have to lie to people, you know?
Yeah.
Do you work mainly with females or males as well?
Males as well. Yes. Okay. Yeah, females and males. Yeah.
Do you find that more females go for hypnosis?
Of course. More females go to therapy in general.
Yeah.
Still. But men are starting to be open for it.
Good.
Yes, because they're seeing that they have problems in their relationship, in their marriages, in their work. So they are also starting to ask for hypnotherapy.
Love that.
Yeah, and not just the wife said, okay, you go, but they are asking for therapy, because this is very important.
Yeah, I always say you can't force somebody to do anything. Your wife might try and force you, but until you want to do it yourself, yes, your wife might force you to go, but you go and you're not going to participate. You're not going to get into that state, you know, that alpha theta state that we were talking about.
No, you will not open.
It will be impossible. You won't open up. You need to be willing to want to do it.
True.
I always say leave that person, suggest it to somebody, they will do it when they're ready.
Yes, absolutely, yes.
I feel like I've learned quite a lot about hypnosis here, and now I am ready to come to you with all my problems. I have a list. I'm like, right, let's go. 2-hour sessions, one a week.
What do you want? I will give you what
Literally,
you want.
Literally, I don't know if I want to talk about it on here. I have issues that I need to get rid of, but I know there's things that I'm aware of. You know, it's not like I don't know.
Yeah, of course. I mean, we know what are our issues, but let's say if we have tried to overcome them and we are not succeeding in that, then we need to go more deeper. Then we need hypnotherapy.
Yeah.
Yeah.
Agreed.
So,
100%. Is there anything else you would like to add that you feel we haven't touched upon?
well, I just want to let you know that try hypnotherapy if you're struggling with some problem and you haven't overcome, or just if you want to improve yourself, or just if you think that I'm not living the life that I'm meant to be. I'm here to help you find out what is that
I love that.
and how we can bring it to the surface, because you deserve it and you're worthy of it.
Yeah, I love that. That's so, so nice, and it's so powerful. So tips for anybody, if you haven't tried hypnosis, definitely.
You can contact me.
Yeah, if you're in Dubai, or if not, you'll Zoom
Even
as well.
if you're not,
yeah,
yes.
exactly. I will leave Dr. Anna's contact information below. Your Instagram. Have you got a website?
Yes.
Yeah. You can send it to me. I can add it in the show notes, and anybody can contact you, even if they need to ask questions.
Yes.
Anything at all.
Yes, I'm very fast on responding.
Yeah.
So I'm responding personally.
Perfect. All right. Well, thank you so much for coming on, and thank you guys for watching, and I'll see you next week.